I would now like to invite Dr. Jason Choo to the stage to give the opening talk for today's public forum. Dr. Choo is currently a renal physician at the Department of Renal Medicine, Singapore General Hospital. He graduated from the University of Melbourne in 2000 and received his postgraduate degree from the Royal College of Physicians, United Kingdom in 2005, and is a fellow of the Academy of Medicine. His topic today is, how does diabetes cause kidney failure? Can we put our hands together and welcome Dr. Choo?
Thank you, Sango, for the introduction. I'd like to thank KDF for inviting me to this forum to give this talk. And I would like to applaud the audience for actually coming to listen to us. The title of my talk today would be, how does diabetes cause kidney failure? And this is not an uncommon question in our many clinic sessions. Patients and relatives often ask us, how does diabetes actually cause kidney failure? And most of the patients who come to us have already got established kidney problems whereby we would be dealing with the diabetes and the high blood pressure. So the outline of my talk today would include 1, current and future trends in diabetes mellitus, 2, how our body actually processes glucose, 3, diabetes mellitus classification, how diabetes causes damage, and of course the many complications from head to toe and in between the vital organs, as Dr. Gordon Koo has said, and of course focusing on diabetic kidney disease. And at the end, we'll talk about the natural history of diabetic kidney disease, and of course, most importantly, urine protein leakage and its role in diabetic kidney disease. So diabetes is fast becoming a pandemic. It's fast becoming a problem, and WHO and CDC thinks that it is really a major problem, especially as a chronic disease worldwide. So this is actually from a journal, an article whereby they look at the projections of diabetes and the number of people who would have diabetes in the world. So starting from 1997. So 1997, 2010, and the projection for 2030. In 1997, the prevalence of diabetes of people with diabetes worldwide stands at 135 million, and at 2010, so last year, 285 million people have diabetes, and this consists 6.4% of the world's adult population. And in 2030, this would be projected to increase to 439 million people, which would be 7.8% of the world population. So 1 in 15, 1 in 16 adult people would have diabetes. So in Singapore, the National Health Survey conducted by Ministry of Health, which is done on a 6-yearly basis, 1992, 1998, 2004, 2010. So they looked at chronic diseases and they looked at what the disease burden is on Singapore. And in 1992, 8.6% of the adult population in Singapore over the age of 18 actually have diabetes. And as you can see, over the years, it's been increasing. And as of last year, the report hasn't really come out, but it's been published in newspapers. This has risen to 11.3%. So 1 in 10 people, if the people who come to this audience are all random and they just walk off the street, so 1 in 10 people, so one row has about 10 persons, so every row, 1 person would have diabetes. So, and this is running in parallel with obesity. So obesity, being overweight, it is becoming a problem also in Singapore. So it's risen 2 times since 1992, from 5.1% to 11% in 2010. So this is a major problem because diabetes, at least more than 55% of patients with type 2 diabetes, I'll touch a bit about type 2 diabetes later, but more than 50% of patients with diabetes are actually obese. Okay, so obesity is also a problem, and this parallels the trend in diabetes. So as you can see, high blood pressure and high cholesterol, there appears to be a plateauing and there doesn't appear to be an increase, according to these surveys conducted by Ministry of Health. So causes of end-stage renal disease, so patients who have totally failed their kidneys, so who have got maybe 5% kidney function requiring dialysis in 2007, okay? This is data as of 2010 by the National Registry of Diseases Office by the Ministry of Health Singapore as well. So as you can see, diabetes mellitus actually contributes to more than 50%, more 58.7% to be precise, of all patients who went on to develop end-stage renal disease on dialysis in 2007. And this is a far cry from 1998, whereby only 47% of patients had diabetes diagnosed with end-stage renal disease requiring dialysis in 2007. And the other conditions, glomerulonephritis, which is inflammation of the kidneys, stands at 20%, and high blood pressure stands at 10%, sorry. So I'm just going to talk a little bit about diabetes and glucose, and I'll talk a little bit about the digestive tract and how we actually metabolize our glucose and how diabetes comes about. Okay, so if we look at the digestive tract, we have our mouth, we have our glands, okay, and we have our esophagus, whereby when we swallow our food, and we have the stomach and the small intestine. Around here is small intestine and our large intestine, or our colon. Okay, large colon. And here we have the liver, and behind this, behind the stomach is this all-important organ called the pancreas. Okay, so when we eat, so food travels down the esophagus, goes into the stomach, okay, and after 4 hours of mechanical breakdown, this empties into the duodenum, okay, which is the early part of the small intestine, and this goes into, and then it goes into the intestines, okay. So within the digestive tract, okay, carbohydrates that we eat, which are complex glucose, are broken down into glucose, okay. Glucose are simple sugars, and these are broken down by enzymes, mainly from the pancreas, which is then absorbed by the intestine and absorbed into the bloodstream. Okay, so again, so when the blood glucose enters the bloodstream, the pancreas, okay, which is behind the stomach, okay, so I brought it up, it's behind the stomach and it looks like that, okay. It detects this heightened glucose, and this is pretty much nearly immediate, 5 to 10 minutes after the blood glucose enters the bloodstream, then the pancreas will actually secrete insulin. So insulin is actually a hormone that is secreted by the pancreas, okay, and it's a hormone which helps glucose enter cells, okay. Glucose acts as an energy source when it's in the cells, okay. So the glucose actually needs to enter cells to be of any use to the body, and insulin actually helps glucose enter cells to use it for energy. Besides glucose from the food, okay, there's also glucose that comes from the liver, okay. If, let's say, you're not eating, so to balance out the glucose, as your brain needs sugar and all that, the liver is able to produce glucose from its stores. Okay. So yeah, insulin is secreted from the pancreas, yeah, and this goes into the bloodstream. So in the body, okay, glucose is always kept within an optimal range. It is never allowed to go above a certain limit, and this is regulated by the liver and by the pancreas. Okay, it is so when you eat food, it gets broken down, it gets absorbed, and the glucose goes into the bloodstream. Insulin from the pancreas will help in maintaining a low level of sugar in the body, so as to allow the body, multiple organs, to use up the glucose for energy. Okay, so now comes the problem of diabetes. Okay, diabetes is a disorder characterized by high blood glucose levels. Okay. So in diabetes, there's a problem whereby the sugar levels in the bloodstream is at a persistently high level, and this is what we call hyperglycemia. There are two major ways whereby diabetes can come about. Okay? One is from a lack of insulin, so the pancreas is not able to produce insulin. And two, there is a problem with the usage of insulin at the cell level. Okay? So at your muscle level, there is a problem with the insulin resistance at these levels. So you may have insulin, but the many organs in the body is not able to utilize the insulin. So a little bit about the diabetes classification. Okay? In simple words, type 1 diabetes, there are two major types of diabetes, type 1 and type 2 diabetes. Type 1 diabetes is also called insulin-dependent diabetes. Okay? And this commonly occurs in younger people, in children and in young adults. So what happens in type 1 diabetes is that there is a problem with the pancreas and there's a problem with the immune system. The immune system makes these antibodies, and these antibodies actually attacks the pancreas and cause the insulin-making cells to not make insulin. So you have destruction of the islet beta cells in the pancreas. Okay? So as you can see here, this is the pancreas, okay? And within the pancreas, you have these islet beta cells. There are about 1 million islet beta cells in a healthy adult person, okay? And with type 1 diabetes, all these are destroyed because of these antibodies that's targeting these islet cells, okay? And this 1 million, they only consist about 1% of actually the total mass of the pancreas. So in essence, type 1 diabetes is actually a condition whereby there is no insulin production because of destruction of these cells within the pancreas. And because of lack of insulin, because of destruction of these islet cells, you need insulin injections even at the start. So Dr. Kevin Tan later will tell us about insulin use and also about diabetic medications. So type 2 diabetes, this is by far the majority of cases of patients with diabetes that we see in the adult population. So up to 90% of patients with diabetes actually have type 2 diabetes, especially in the adult population. Even in Singapore, in the United States, it's the same, 90%. So what is this condition, type 2 diabetes? So it's a condition whereby the body cannot effectively use the insulin it produces. And this is because of the insulin resistance at the body level, at the fat level, at the muscle level. There is resistance to the usage of insulin. So there is a lot of insulin, but actually the body is not able to use it properly. Okay. But over time, as the disease progresses, there will be problems with lack of insulin because the beta cells from the pancreas, remember the beta cells from the pancreas, actually start to fail. There will be overproduction of insulin. Then as time goes by, because of this overproduction, it will fail. And there will be no insulin in the body, and these are the patients whereby they will require insulin. So for type 2 diabetes, usually occurs after 40 years of age, and is strongly associated with obesity. So if you're overweight, you've got a big waist, then your likelihood of developing diabetes is there. It is also associated with a strong family history. If you have a very strong family history, if your brothers and sisters, your parents develop diabetes at 40 years of age, 30 years of age, then the likelihood of you developing type 2 diabetes is also very high. Okay. So what happens in type 2 diabetes is that to control type 2 diabetes at the start, okay, it is a problem with insulin resistance, right? So there are oral medications, there are medications that can control sugars, and these medications can help with the insulin resistance, so help the end organs, okay, the muscles and all that, to be more sensitive to insulin, or can make the pancreas produce more insulin so as to overcome this problem of resistance at the end organ level. So, but at the start, this may be adequate, but over 5, 10, 15 years, Then as the pancreas start to fail,